Hi, I'm Dr. Rhea Hogseth, founder and director of the Pediatric Dental Assistants Association. As pediatric dentists, one of the main things we try to do is prevent decay in our patients. One of the best tools we have to help us do that are sealants. Of course, when we do sealants, we're always concerned with the retention of those sealants. There are a few key components that are critical to your retention rates when you are placing a sealant. One of those is making sure you've removed all the plaque and debris from the tooth surface that you are planning on sealing. A great way to get that really super clean is using an Etch Master micro etch technique. Now this is an adapter that goes right into your 4-hole handpiece tubing of your slow speed. It's very different than the air abrasion methods that we used in the past. This is a very low flow. It will not create any kind of hole in the tooth, but it's awesome for removing plaque and debris. Another critical element is the isolation, making sure the tooth stays dry. So whether you're using dry angles, cotton rolls, rubber dam, or a isolite or dry shield type of apparatus, the isolation is key. You want to make sure you can keep the tooth dry. If you're having a difficult time with that, you might consider using a hydrophilic sealant instead. That is not as critical keeping it dry, but you still want to use the best isolation that you can. Another element is your etch. You want to make sure you have a great etch to get those microporosities to help us with the mechanical retention of the sealant. So whether you're using a liquid etch or a gel etch, you want to make sure it has the capability of flowing down in those deep pits and grooves. So if you are using a gel etch, just make sure it has not dried out, that you still have plenty of liquid in it that allows it to flow down into those areas of the tooth that you need to get those microporosities. So again, we want to make sure that the tooth is kept very dry. If you're able to keep it very dry, then you can use a resin-based sealant. Those have proven to be very strong and very durable on the tooth. Again, if you're having some trouble with that, you might look at using a hydrophilic type of sealant, which tend to be more of our glass ionomers. There are some sealants that have the compilation of both the resin-based sealant along with the glass ionomer type of sealant so that it has a fluoride release. So that fluoride release is awesome for our sealants, and I urge you to look at those. Another element is how much sealant you're placing. Too much sealant will increase your risks of it being chipped off with normal occlusion. So I suggest maybe looking at it as if you're looking at the Grand Canyon and the Colorado River running through it at the base, that Colorado River is not all the way up to the top of that Grand Canyon. It is way down at the base. So you want to use just the right amount of sealant that will seal off those grooves and pits, but not increase your risk of them being chipped off. Now we know sealants are very effective on our permanent molars in preventing decay. I urge you to also consider using them on premolars and certainly the lingual pits behind 7 and 10 that are sometimes very deep. I routinely recommend them on primary molars also. I think it's important to give our parents the knowledge that there is something out there that can help prevent decay on those primary molars, and then let them choose whether they want to have that treatment done or not. I think it's very important, especially if it's a younger sibling of a patient who had a lot of occlusal decay, or maybe a patient that's had just one pit that needed restoration. Definitely counsel your parents that there is another way that they could help prevent decay by placing a sealant on those primary molars. You can find modules that discuss using the Etch Master micro etch and how to place sealants with different types of isolation in the members only area of the Pediatric Dental Assistants Association website. That website is www.thepdaa.org. I'm Dr. Rhea Hogseth. This is a practice pro from the PDAA, and I'll see you on the next one.